Absolutely amazed to see a story over this week about staff being banned from working in multiple care homes as infection rates rise. Absolutely blows me away that was still something that was allowed even until now. Well, let's talk to Martin Green, OBE's Chief Executive of Care England, and joins us now. Good morning to you, Martin.
Good morning,
Good
Julia.
morning. I do just find it utterly extraordinary that this is a measure that is only now coming into place. Staff will be banned from working in more than one care home. The government is drawing up legislation to make it actually illegal to employ staff working at multiple sites. We knew really early on in this pandemic that we were seeing massive spread in care homes, and one of the early suggestions was that it was staff working in one care home where they had an outbreak and then working in another care home doing shift work and agency work. How on earth has this not already been outlawed?
Well, I think what I would say is it is common practice. And so the majority of people are not working in multiple care homes since the pandemic. So this is something which is a minor issue. What I would also say, I'm really confused why the government is rushing through legislation on this, because there are lots of mechanisms in which they can enforce it. So there are already regulatory regimes. I'm also particularly interested as to why they haven't stopped NHS staff and indeed Care Quality Commission inspectors going in and out of different care homes, and they are doing that without testing. So I'm really unclear why the government has decided to single out this particular issue when there are other issues that they also have direct control over, like the NHS staff and the Care Quality Commission inspectors, where they've done nothing.
And when you say NHS staff, you mean sort of GPs, the community nurses, and coming out and seeing a patient, presumably getting certainly, up close, touching the patients, being with them for a considerable period of time in some cases, and they don't have to have a test showing they're negative before they enter the care home. I mean, are you serious?
Yeah, I am serious, unfortunately, and I just do not know why that hasn't been implemented. And the other thing about the start of this pandemic was that one of the ways in which the transmission rates were going up in care homes was precisely because of the engagement with some NHS staff and also, of course, with people being discharged from hospital without a COVID test. So I don't know why the government has decided to single out care providers for this particular measure. I also think they should be really mindful of the fact that care staff are working incredibly hard, and many of them are finding it a big struggle to make ends meet. And they need to put in place some measures whereby if you can't work in more than one care home, you might have your salary or your wages topped up by the government in order to make sure that you're not out of pocket.
Yes, in the same way that they are losing out, although we're presumably, I mean, again, lots of people working, doing Thursday, Friday in one place, Monday, Tuesday another place. If no one's allowed to do that, then all just working in one care home, that would make sense. But this is I think what I find, and I'm sure every listener just finds absolutely extraordinary. We know who's at risk from this virus. We know it's the elderly. We know it's the vulnerable. I've whittled on about my aunt in her care home. I mean, the state of some of the people in that care home. Frankly, if you opened a window, I think a lot of them wouldn't survive the week. I mean, really, really fragile people. But so I can't go and visit my aunt. I can't go in. I can't see her. I can't even just sit in the garden 3 meters away from her wearing a mask, because that's a big risk. But a doctor or anyone else can walk in there without a COVID test, or another patient from a hospital can be sent to that care home without having a negative test. And that's just fine, according to the government. This is a level of insanity, which I think is it's. I can't even. I'm not often speechless, but I'm genuinely speechless at this.
Well, I can really understand why, Julia, because, one of the other things that's been happening is we were promised weekly testing for staff in care homes, and we were also promised that we would get monthly testing for care home residents. And unfortunately, on the weekly testing, not only have we started to see a really long time delay before we get the results, and in some places, the results haven't come in before the next test is due. But I also saw something from the Northeast yesterday where somebody from the testing centre had said we're not prioritising care homes. Well, this is complete and utter ridiculous behaviour. As you said so eloquently there, we know that people in care homes are absolutely at the most risk. So we should be doing absolutely everything in our power to protect them. And what we do need is the testing to be extremely regular. And, I also want to see some of these tests that you can get the results in 20 minutes. That would mean we could test absolutely everybody going in and out of care home. It would also mean, incidentally, that we might be able to work a bit quicker in reinstating some people as visitors, particularly when we've got people who might be very frail or at the end of their life. So I'm really unclear why the government has knee-jerked on this when there are so many other bits of the system which they're in control of, that they could just say, we need to get this sorted.
I'm genuinely, I am so horrified that we are doing exactly the same wrong things again, despite all the information we have, and we're not protecting the people who are most vulnerable. But by all means, let's test a load of healthy 20-year-olds at university instead of the people who really need it. Martin Green, OBE, Chief Executive of Care England, thank you so much. Final word to Dave Chawner. Dave, are you as absolutely befuddled by this as I am?
Well, I'm kind of despairing at you, really, because I think, again, you're trying to use common sense. And I think, as we all know, that's very outdated and it will not catch on.
It's genuinely terrifying, isn't it? I mean, it's genuinely terrifying.
It's so weird.
So this stuff is so basic. I mean, genuinely, can we put my 13-year-old in charge? She would do a better job. It's as simple as that.
I think that would be great. To be honest, there are loads of people in Houses of Commons on the left and the right. They act like 13-year-olds should anyway. So, fine. Let's do it.
I mean, seriously, right. She's in charge. We can have this sorted overnight, I'm telling you.